Hello, and thank you for joining us this evening. I'm Yvise Tucker with the American Diabetes Association, and joining me is Susan D. Abate, Centera Healthcare Diabetes Prevention Program Coordinator. Thank you, Susan, for joining us for Tour de Cure Virginia Wellness Week.
Thank you so much. Just a little addition to that, I'm also the diabetes outcomes coordinator for 8 sites in Hampton Roads,
Okay,
7 in Hampton Roads, and that also includes Centera Albemarle. So both diabetes and diabetes prevention. We
awesome.
do.
Thank you for that clarification, and thank you again so much for being here. Susan, the past year has been a challenging one on many levels. Why is it so important for individuals living with diabetes to still be focused on their diabetes and chronic disease care, especially in the midst of worries and safeguards around the COVID virus?
So yes, wholeheartedly, it has been challenging. And unfortunately, people with diabetes significantly affected by COVID. To be perfectly honest, people with diabetes has a significantly increased mortality rate due to COVID exposure. So when many people may have just a little bit of flu symptoms, those with diabetes, especially those who have blood sugars out of control, but even those in control, may experience significant adverse reaction to the COVID and certainly an increase in mortality and death rates we're seeing.
Wow, wow, very, very enlightening and something we should all be very aware of and make sure we're using extreme caution. Thank you for that. We talk a lot about knowing your numbers. What are the key screening numbers that individuals with diabetes and other chronic diseases should always be aware of and tracking regularly?
So to start off with, I think truly the diagnosis of diabetes and or pre-diabetes is really significant. Um, Many patients come to us believing that they have pre-diabetes when they actually have diabetes. So when we look at the numbers, and the first primary number we take a look at is what we call the hemoglobin A1C. And that number for a person who has pre-diabetes is 5.7 up to 6.4. And that is independent of being on any kind of medication for managing that control. A hemoglobin A1C of for diabetes is 6.5, and ideally we'd like to keep it under 7. But we do know that, of course, some people, depending on their control, may run a little bit higher. What happens sometimes with people with diabetes is once they're in good control, they may actually lower their hemoglobin A1C down to 6 or even 5.9. It doesn't mean the diabetes went away. It just means what they're doing to manage their diabetes is now very, very successful. A normal hemoglobin A1C, if you did not have diabetes, depending on the lab, there might be a little bit of variation, but usually about 4.4 to 5.6.
Awesome. Thank you. So I guess a great key takeaway from there is definitely knowing your numbers. We want to keep that A1C level under 7. Thank you for that. Tell
For
us
those
more
with diabetes.
with diabetes. Thank you
Yeah,
for that
yeah.
clarification. With
So
diabetes.
pre-diabetes, we want it
Yes.
under 6.4.
Awesome. Pre-diabetes under 6.4. Hopefully everyone caught that. Thank you, Susan. Tell us more about how diabetes care specialists are an integral and key part of a healthcare team in managing diabetes.
So in a lot of different ways, and I think truly one of the big missteps or misconceptions of what we do as a group of educators is that a lot of people feel that when they come to class, and if they come to a group class or even an individual class, one-on-one, they feel it's that one time and that's it. They come, oh, I've been to class. But truly, the work of the diabetes care education specialist is ongoing for the rest of the lifetime of that patient. And so there's an opportunity for us to collaborate and provide support to that patient on an ongoing, regular basis. For example, if a patient goes to surgery, what questions do they need to ask their surgeon, or what questions do they need to find out from their primary care doctor to let their surgeon know about diabetes or how to manage it after surgery, those kind of questions. So we can help guide them through those questions. So there's a lot of different things in day-to-day life you don't get in one group class. You just don't. We provide basics of diabetes, a foundation to work from, but there's no way that you're going to remember everything we said, even a year later, much less 20 years later.
Absolutely. And that's a great point. So consistency is best and to
Yes.
continue to come to the classes.
Yeah. And
Thank you.
whether you have insurance or not, there certainly is available education out there. But for those of you who are worried about, well, will my insurance cover it? Insurance generally will cover the cost of services that are provided by many of the hospitals ongoing, at least for the initial education as well as for subsequent years without any problem. That's an expectation.
Awesome. That's good to know. Thank you for sharing that. Very good information. Susan, as we wrap up, can you please share with us what are some of the services that hospitals and care facilities can offer individuals living with diabetes beyond just their regular checkups?
So, so within the hospital, again, for the education component, we offer that ongoing management of diabetes. So you've been to the doctor, you've had adjustments in your medication, you need to kind of revisit nutrition. We have what is called medical nutrition therapy, where you have one-on-one opportunity to visit with the registered dietitian, and make additional adjustments, or as you put together some of the pieces in managing your diabetes previously, or perhaps things that you have forgotten. And then in addition to that, we have some additional services, especially here at Centera Virginia Beach General, called remote patient monitoring. So we can actually see, if you agree, if the individual agrees, we can actually see their blood sugars done in real time as they're doing it, and see, identify trends on a daily basis, send them a text message, an email, depending on which way they prefer the communication. And sometimes if we start seeing a trend that is going up, we'll say, please call the office, so that we can get in touch with that individual to kind of find out, did they run out of insulin? Are they having trouble getting the prescription refilled? What is the issue? So that sometimes we can actually problem solve for them or help to resolve what is causing the deficits. At times, of course, it's, oh, I went off the wagon a little bit, and I had 2 birthday parties to go to, and and I overindulged, and my blood sugar went through the roof. But again, at least we are having those conversations and perhaps redirecting and say, not that you shouldn't have done that, but here are some other alternatives. You could have enjoyed your cake, but maybe perhaps not quite as large a piece of cake, depending on what the conversation was. And we really never tell people, oh, no, you can't do that. There is no such thing you can't do. There are better choices. And we help to kind of open people's mind to what some of those choices really are.
Awesome. That sounds great and some really good tips. And I think sometimes you said, that, the key is being consistent. And if you fall off the horse, like you say, just get back on again. So I think that's
Exactly,
a great
exactly.
reminder as you continue
Yeah.
to educate the community on diabetes. Susan, thank you so much. This was all wonderful information, and we appreciate your time. And thank you all for joining us. We hope
Thank you so
everyone
much.
continues to stay well. Have a great day.
You take care.
Bye bye.
Bye bye.